Good morning, everybody. My name is Gabe Sanchez. I'd like to welcome you to the impact of deportation policy changes on Latino immigrant communities. I'm a senior fellow in the Governance Studies program here at the Brookings Institution, and on behalf of Brookings, I'd like to thank all of you for making time with us this morning to talk a little bit about a really important topic, deportation policy, and specifically the implications that it has for Latino immigrants. The way that this program will run is myself and Dr. Edward Vargas will present some slides reflecting the data that was collected with the 2025 Latino Immigrant National Attitude Survey. After we finish our presentation, we will turn over to a panel of experts on immigration policy and specifically Latino immigrants who will break down the findings of the survey in more detail and will lead us into a question and answer session that will feature any questions that you folks in the audience may have for us. At Brookings, we always make sure that we keep on time to allow all of you to have an opportunity to ask questions. I will remind you of this, but if you have any questions along the way, please email those to events@brookings.edu. Again, events@brookings.edu. I promise I will sort through those and get as many of them in as possible, because I know after you see some of this data, you're going to want some follow-up insights from our experts that we have with us today. Only other housekeeping item that I will note is the landing page for this particular webinar, where all of you RSVP'd, will also be the place where we house the slide deck from this presentation and any other materials. So you don't have to worry about trying to take snapshots of any of the slides that we feature. We'll make sure we post the full slide deck after we finish up today's webinar. So those of you that are data nerds like myself have an opportunity to take a closer look at any of the data points that are available there. There's also featured on that page a blog post that summarizes a few of the high points of the data that we'll be unveiling for you today. So thank you very much. I greatly appreciate some of you getting up very early that are on the West Coast for this presentation, and we look forward to a great discussion with you today. So as we go ahead and get started and jump right into this, I want to say a little bit about the context of this particular survey before we get into the nitty-gritty of the data presentation and then the follow-up with our panelists. I will say that this project is a little bit distinct from some of the others that I've run, where it's typically a nonprofit organization, a foundation, somebody essentially commissioning a study of this kind. In this case, I think a number of us that are experts in the space of Latino politics, immigration policy, and politics all collectively understood as soon as we saw a shift in the federal administration and a significant increase in the discussion around deportation and mass deportation, that we were all worried that there wasn't any data capturing this moment in time and telling the story of the struggle of immigrants as they maneuver around this very challenging environment. So my colleagues, a subset of which you'll hear from today, essentially all came together and said, let's make something happen. Let's get some data out there. Let's get into the field and start collecting data as quickly as possible. So all these scholars, to their credit, found resources within their own research accounts, raised some internal money at their institutions, and we all collectively pitched in to make this project happen. And I think that's an example for a lot of us. Many times you feel like there's big shifts in public policy. How are us, as non-elected officials going to do anything about it? Hopefully this is an example, at least for scholars in the audience, of a mechanism to move quickly, mobilize yourselves, and at least try to tell the story of populations that might be disadvantaged or might be disproportionately harmed as a result of shift in federal policy or state level policy. So with that context, I'm going to jump right into this. I will introduce my longtime colleague, close personal friend and longtime co-author, Dr. Edward Vargas, who is an associate professor at the School of Transborder Studies at Arizona State University, who will co-present the findings of the survey with me before we turn things over to our expert panel. I don't want to spend a lot of time on the methodology or specifications of the survey. Obviously, if there's questions about this specifically, we'll be happy to take those at the end. And all of you can, of course, email me as the person who typically oversees data collection if you have any very specifics on the sample design, etc. But just some of the high points. You see, this was a relatively large sample specifically of Latino immigrants, an N of 1,000. And we worked really hard on our team to make sure that the survey is balanced and representative of that larger population. So you see we had a mix of both non-citizens and naturalized Latino immigrants in the sample to be able to make comparisons based on how folks' immigration status impacts the way they're living through this current period of a shift in deportation policy, and whether or not they have different resources to lean on as they try to maneuver around, again, a very challenging time. All of our surveys are available in both English or Spanish, and you see in this context, 60% or 6 out of 10 respondents opted to take the survey in Spanish. You see the field dates, April 23rd to May 13th, 2025, so very recent data. But I will point out, those of you that are immigration hawks in terms of policy and paying close attention to the national news, this survey was fielded right before we saw a significant increase in deportation activities, a lot of that reverberating across the community, and before we saw a lot of the activities in Los Angeles, including widespread protests, not only in LA, but across the country. So I note that because if anything, I think a lot of the numbers that we share with you would only be more extreme. And I'll give you a few examples of that, and Dr. Vargas probably will as well. That gives you some sense, if anything, the picture that we're painting is only unfortunately going to be more negative if we were fielding this survey currently, right, going into the field today. You see, we take a blended approach, including capturing folks on web, on telephone, and obviously across all venues, folks have the opportunity to take this in English or Spanish. And the data was weighted to ensure the demographics of the sample, again, match those defined by the US Census, in this context specifically for Latino immigrants across the United States. This has all the bells and whistles you would expect with the rigorous academic-styled survey. Again, we can talk more about that if there's interest in the Q&A at the back end of today's webinar. So the first thing I want to start with is maybe the most obvious, right? And keep in mind, this was a very lengthy survey with a lot of content. Dr. Vargas and I are only really touching the tip of the iceberg, so to speak, in terms of the range of content that is available from this wider team that's going to be breaking out their academic research, drawing from the data. But we wanted to give you kind of the high points across several themes. And the first is that there's strong evidence from the survey of this current climate, again, uptick specifically in deportation, not only policy, but the policy discussions surrounding the deportation raids, et cetera, and the activities by ICE, that there's been a heavy, what we refer to as chilling effect among Latino immigrants. Dr. Vargas and I were part of a team way back 10 years ago in 2015 that unveiled a similar survey. And I'll tip my hat to Dr. Francisco Pedraza, also at Arizona State University, who thought deeply about how we quantify or measure this notion of living in the shadows and chilling effect. Some of these items are consistent with what we've used in the 2015 survey, and I'll note in some places what we've seen over that 10-year period in terms of differences across the sample. But as a very basic indicator, right, we asked the full sample, how much, if at all, do you worry that a family member or close friends in your network could be detained or deported? And you see over half of Latino immigrants nationally have very strong concerns and worries, as you might imagine, in this particular climate where they're seeing folks every single day, almost hourly, unfortunately facing this difficult situation of detention and deportation. You see 19%, roughly 1 in 5 Latino immigrants across the country worry about this constantly and at a great deal. Right, so we know that this stress, this pressure of constantly, the literature suggests, feeling like you're hunted, poses health implications for Latino immigrants in particular. I know something that the panel will talk about in more depth. We also asked the full sample, do you yourself worry that you might be detained or deported at the individual level? And you see 36%, over a third of Latino immigrants across the country have that constant stress of not only people in their network, but they themselves potentially being detained or deported. For some context, this is about 10% higher in terms of worry than we observed in 2015 with the first study of this kind that Dr. Vargas and I conducted. This chilling effect, I give you a snapshot of a number of different items that we raised to the sample to get a sense of whether or not they've avoided any of the following places or activities, specifically because of the current political environment and, again, the deportation specifically that have been announced and carried out by the Trump administration. You see some of these items, right, give us some sense that the implications of the chilling effect are not specific just to the immigrant population or just to Latinos. They probably have consequences for a much broader level of Americans and for society overall. The one I'll draw your attention to is the fact that 16% of Latino immigrants have reported that they've already stopped calling the police to report a crime or contacting the police for any other matter that they themselves or their family might need help with. That 16% number, again, right, put in context, is important for all of us because it has direct implications to being able to address crime issues in all of our communities. So I stress that one because, again, in a number of places, these are things that are going to reverberate across the entire country, not just among Latinos or not just among immigrants. Similar to thinking about broader implications, look at the dynamic of 13% of Latino immigrants who have avoided seeking medical attention at hospital clinics or other healthcare facilities. A lot of us on this panel are public health experts, health policy experts. I'm sure they will speak to the longer term implications of folks not getting the immediate care that they need and how, unfortunately, that compounds in many situations adds significant cost to our healthcare system. You see folks are avoiding everyday activities like even going to parks and recreation areas, just being able to enjoy their lives as Americans, right, as a context of this very challenging environment. Also, in the context of thinking about the economic implications for this, we see 1 in 10 Latino immigrants reporting that they're not going to work on a regular basis, again, because folks, unfortunately, are being detained and deported at their workplace, and even avoiding really important financial behavior, like applying for a loan, opening a bank account. So this gives you just a snapshot that, unfortunately, this chilling effect is having broad implications. It's shifting the behavior of Latino immigrants, and this shift in behavior has implications for all of us, not just those of us from that particular community. I will say that this survey tracked more the everyday experiences of immigrants, the day-to-day behavior shifts, etc., not as in-depth as it pertains to policy attitudes per se, but we definitely wanted to make sure with this opportunity to talk specifically to Latino immigrants that we had some policy content available for all of you in this webinar. I know many of you are most interested in how we're thinking about the attitudes and the policy implications for what we're observing every day in this environment. So just a snapshot of this. I think this slide gives you a snapshot, at least of what a lot of reporters that have called me over the last couple of months have been most interested in. And that's this question of who exactly is being deported or detained. Obviously, in the presidential election, we heard a lot of campaign messages from the Trump campaign and other Republicans specifically noting that mass deportations, when they will happen, would be focused specifically on criminals, and much of that messaging directed at violent criminals. We know that hasn't exactly been what's played out in terms of the implementation of deportation policy. So this gives you a snapshot of whether or not Latino immigrants specifically, folks that we might anticipate would be tracking the news in this area greater than the wider population, are aware of this potential disconnect between campaign rhetoric and what we're actually seeing in implementation of policy. You see that one trend that I'll pick up on is, there's a sizable segment of Latino immigrants that both agree with the snapshot that you see in front of you, that most immigrants who are in detention facilities or who have been deported have probably committed serious crimes in the United States. A sizable segment of Latino immigrants have essentially bought into that narrative. And you see also 1 in 5, 22% in both cases, indicate that they're not exactly sure. And I think that speaks to the very challenging environment in which we're living in, where you've got fake news, you've got a lot of rhetoric out there that makes it very difficult to disentangle what actually is happening and who should I hold accountable if I believe that the policies that I thought I was supporting during the campaign aren't being implemented at the same way and in the same method, right? So that gives you a snapshot at least of how Latino immigrants in particular are receiving this environment and whether or not they're seeing a disconnect in terms of what they've heard about deportation, what they're actually seeing on the ground. Before I walk through some of the specifics on this slide, looking at some of the policies that were specifically tracked among Latino immigrants, just some context as you're observing this data. This is in the backdrop of President Trump doing significantly better across a lot of different subgroups of the electorate than in his prior election, including among Latino voters and even among Latino immigrant voters, right? So the backdrop of that is, I know a lot of you are interested in it, now that we're seeing these policies being implemented, right? How might Latino immigrants in particular shift in terms of their policy preferences and ultimately, right, thinking longer term, their voting behavior? So you see across the board, the majority, in many cases, vast majority of Latino immigrants in our sample strongly disagree with President Trump's immigration agenda, right? You see in this strongest example, 69% of Latino immigrants disagree, many of them strongly disagree with ending American citizenship for children born in the United States who are parents of undocumented immigrants, right? So you see that's one that generates the strongest reaction in a negative way among Latino immigrants, but you also see 64%, a strong majority of Latino immigrants also indicating that they disagree with the administration's use of the Alien Enemies Act of back to 1798 that allows essentially detention and deportation of immigrants without providing them with a court hearing or an asylum screening, right? So you see strong opposition in many cases among Latino immigrants to these policies. Again, I think if we did the same exact survey today with more opportunities for immigrants to see what's going on across their environment, I suspect opposition would even be higher. So with that, I will turn it over to my long-term colleague, Dr. Edward Vargas, who again is Associate Professor at the School of Transborder Studies at Arizona State University, to walk us through the rest of the content.
All right. Thank you, Dr. Sanchez, for setting this up. And again, thank you all for joining us for this conversation. I first want to reiterate and center this conversation to remind folks that we are, again, studying Latino immigrants in this sample. This is important as we continue this conversation related to discrimination, health, and health outcomes, because we tend to find that, in general, Latinos, particularly, and immigrants in general, do better on when it comes to self-reported health, mental health. They do better when it comes to, or not saying that they experience as much discrimination as, for example, U.S.-born Latinos. We also want to reiterate that and think a little bit deeper about sort of the differences in push and pull factors in terms of why people may be leaving their country. With that said, for example, we find that in this sample among the foreign-born, in the naturalized section of this data, these are particularly people who have been here longer, and these are people who came because their parents brought them, as opposed to the most recent sort of people that came in the past 5 to 10 years who are non-citizen, who maybe are escaping political turmoil, violence, gangs in their countries. And so when we turn to the conversation of discrimination in health among immigrants, again, it's important to point out that in general, the literature has shown that immigrants on average are less likely to report discrimination and report poor mental health. And so as we turn to some of these slides on this, when we asked immigrants that if there seems to be a lot of anti-immigrant and anti-Hispanic sentiment and policy surfacing in these years, we find that, you know, around almost 70% of immigrants are saying that they definitely feel as if there is this some or a lot of discrimination towards the immigrants. Again, around 82% who are saying this. When we turn to favorable or whether or not you believe where you live is unfavorable or favorable towards immigrants, we see this picture that around 39% of Latinos are saying that they live in a place that's unfavorable. Now, this is really important because our academic and peer-reviewed research has shown that if you say and you believe that you live in a state that is unfavorable, you're more likely to report poor mental health, not just for yourself, but even for your family. And you're also more likely to report discrimination while visiting a doctor. You're more likely to say that the health quality that you're receiving isn't the best. And so that's really important, I think, for us to note as we're looking through this data. When we ask Latinos about discrimination, and again, is there a lot of discrimination towards immigrants? Again, around 82% of Latino immigrants are saying there is some or a lot of discrimination against them. And when we ask them, well, if you've experienced discrimination, why? What have you experienced discrimination? Was it about your, is it gender discrimination? Is it racial, ethnic discrimination? We find that around 20% of Latino immigrants being personally discriminated due to being they're Latino, for being Latino, and 20% due to their accent or speaking Spanish. Another about 11% said that they've experienced discrimination for being an immigrant. Again, evidence to show that in these times that there is a heightened level of discrimination that they are experiencing currently. So going back to whether or not you see your community as favorable. And I talked this a little bit earlier. Again, 39% of the sample said that they believe where they live is unfavorable towards immigrants. What we know about the social determinants of health literature in terms of where you work, where you live, where you play, has clear implications for your overall well-being. And I think some of the panelists at the end will speak a little bit more in depth about what are the long-term consequences of living in a place that you feel does not accept you, does not value your work and the hard work that you do in that community. Turning over to specifically well-being and health, we asked a sort of an array of questions related to health outcomes for immigrants and their families. And I would like to just show you a little bit about what we're seeing across the board. We see that, for example, the sort of since Donald Trump was reelected in November 2024, has your health gotten better or worse or stayed the same? We find that around 25% of the sample are saying that that their sleep has gotten worse. We know that sleep is tied to a lot of very important health indicators, and some of the immigrants in our sample, in terms of some of the specifics, who reported the highest levels of their sleep quality being disturbed are the non-citizens relative to the naturalized citizens in the sample. We're seeing that women are reporting higher levels of disruption in sleep, and those who are younger. When we look at mental health, which is, 22% of the sample said that their mental health has gotten worse. We're seeing this specifically around legal permanent residents in the sample, those who have been in the U.S. longer. But unlike physical health, here we're finding that younger immigrants are reporting the worst sort of mental health. Looking at physical health, we see that non-citizens who aren't legal permanent residents and older women are reporting the highest levels of poor health. And I just want to kind of look at a little, tune us into your use of alcohol or drugs. And I think this trend across the board has been going down in terms of drinking consumption. And we typically have always found that immigrants use less alcohol or drugs relative to their U.S. counterparts, but we do see some evidence here that around 7% of people are reporting that they are using their relationship with alcohol or drugs has gotten worse since the Trump administration. We find this predominantly true for English-speaking respondents and also legal permanent residents in our sample. Now alcohol or drugs or other vice types of substances we can always assume that they are a little biased. I think most of you all who go to the doctor and the doctor asks you with your checkup, do you drink more than 3 or 4 beers or wine or cups during the week? And most people sort of underbias their accounts, but I think this data is telling that there are people who are reporting more use of drugs or alcohol. Lastly, we want to talk a little bit about insurance coverage. And what we seem to be finding is around 22% of the sample who report not having health insurance right now. So this narrative that immigrants are using insurance, taking up Medicaid, so on and so forth, we don't find that in our data. In fact, we find that non-citizens and young immigrants who have been here for a shorter amount of time are the most likely to be uninsured. I think as this conversation of the big beautiful bill and what this means for Medicaid and cuts in Medicaid, I think it's going to have a detrimental impact on U.S. citizen Latinos, naturalized immigrant Latinos, and I think we're beginning to find some of that evidence here in our sample. When we asked about healthcare under the current presidential administration, when we asked people, do you think your quality or the cost of your healthcare has gotten better or worse or have stayed the same? we see that Latinos are more likely to be saying that the cost, or immigrants are more likely to be saying that the cost of healthcare for their healthcare has gotten worse. I think this trend is continued across maybe 10 years of data, but this distance between quality and cost hasn't been as high. So there hasn't been as much of a gap. But in general, we're finding that immigrants in the sample are saying both their quality of their healthcare and the cost of their healthcare has gotten worse under the current administration. And I'm be really curious to ask some of our panelists about what they think about this data and how some of their interpretations and some of the consequences looking long term.
Thank you, Dr. Vargas. Greatly appreciated you walking us through some of those data points that I think hopefully provides a great context for our panel that I would like to now welcome to join us. I'm going to go ahead and stop sharing my screen at this point so we can see their wonderful and beautiful faces. We as the panel now will shift gears a little bit and allow these folks to react to some of the data that you've all been able to observe. Again, just a housekeeping item, I'll remind folks in the audience, if you have any questions that you'd like our panel to address, please email those to events@brookings.edu. Again, that's events@brookings.edu. Again, I'll try to get as many of those questions in as humanly possible because I know many of you are very interested in hearing what our panel has to say. In terms of a brief introduction, I'm going to allow each of our panelists to also say a little bit more about their work and how it orients them to this particular project. By way of introduction, I'll give all of them a little brief bio and allow them to highlight more about the rich details that they all have in their research portfolios. With us this morning, we have Daniel Lopez Ceballos, who's an associate professor, Department of Health Promotion and Policy at the University of Massachusetts at Amherst. Dr. Carmen Valdez, Professor and Associate Dean of Research and Partnerships, University of Texas School of Public Health at San Antonio. And Dr. Ana Luisa Oaxaca Carrasco, Early Career Postdoctoral Fellow at the LBJ Public Affairs School at the University of Texas at Austin. And I greatly welcome all of you to this panel. Thank all of you for your willingness to participate in today's panel to share your wisdom and your insights regarding some of the data that we've shared today. Why don't we start with you, Dr. Valdez? I'll ask you again, say a little bit more about your work. I know each of you have long and distinguished bio statements. I tried to minimize that as much as possible to leave as much time for you to say what you need to say in your own words. Carmen.
Thank you very much for inviting me to serve on this panel and for being part of the LINA study. So as you mentioned, I work in San Antonio. My research has predominantly focused on immigration and mental health, particularly the everyday experiences of stress that immigrant children and families navigate as they achieve their goals in life and look for a better future. And a lot of my work has focused on qualitative and ethnographic studies. For example, I've been conducting a study in Arizona of 5 families that were affected by SB 1070 back in 2010, and have really been able to see shifts not only as a result of immigration policy, but also just developmental changes in the life of a family. So I came to this study because although my work tends to go in deep with a few number of families, I also appreciate the value of population level data to understand trends, and particularly in the context of immigration policy that is becoming more and more restrictive.
Excellent. Appreciate that. Welcome to our panel. Thank you for making time for this. I'll start things off with you, Carmen. Despite the survey being conducted, as I noted in the little methodology blurb, pretty early in the Trump administration's term in office, as you saw, we're already seeing strong evidence of the threat of deportation generating this powerful, we refer to as the chilling effect, right? Avoiding healthcare being one of the things that we highlighted. I'd love to get your insights on what worries you specifically about the data that we walked through the most, and what, I know a lot of us, I'm already checking the chat function, a lot of folks are essentially asking, what can advocates and others in state government, et cetera, local government, what can we all do to address this issue?
Yeah, well, it's clear that immigration enforcement climate and policy are shaping the lives of immigrants, and especially in ways that are harmful to their health and well-being. And what we're seeing falls along two categories of adversity. One is threat, and the other one is deprivation. So, in terms of threat, this is the kind of stress that comes from real or perceived danger, either to ourselves or our loved ones. As our data showed, for example, danger related to deportation. So now all of us experience some kind of threat in life, but for non-citizens, this threat is very intense and it's also constant. So imagine always being on high alert, wondering if a loved one might be detained or deported. What happens is that your body stays in a fight or flight mode, and even when there's no immediate danger. So it really wears on you physically and emotionally. Our data shows that more than half of the immigrants in our study worry deeply about a family member or a loved one being deported. So this isn't just about a momentary stress. It's going to have long-standing consequences across generations, I would argue. And then the second type of adversity that we're seeing is deprivation. It's not about immediate danger, but it's about missing out on important things that help us grow and thrive. So that includes access to basic resources like housing, food, healthcare, education, and being in safe spaces. So what's concerning to me about what the data show is that because people are living under constant threat of danger, they're avoiding resources that they actually need and that they qualify for. And this is the chilling effect that could lead to deprivation. So we're seeing people skipping doctor's appointments, avoiding calling the police to report a crime, as you mentioned, staying away from public spaces, and some people are even skipping work. And just to give you some context, like you said, this data was collected before ICE ramped up activity in courthouses, construction sites, and just in general on the streets nationwide. So the avoidance we're seeing from the data is likely even worse today than it was when we collected the data. So why does this matter so much? We know that chronic exposure to threat and deprivation can lead to serious health problems for individuals and families, including kids. Kids grow up in constant danger or fear, and this really affects them academically, emotionally, and socially. And trauma like this doesn't just go away. It really shapes how we interact with the world, and it can be transmitted intergenerationally. So what can be done, to your question about what can state and local governments do? They can adopt policies that promote safety and inclusion. Some states are already doing that. For example, California, New York, New Jersey, Washington, Illinois, and the District of Columbia are really leading the way in this. They've expanded healthcare access, provided ID cards, offered in-state tuition for non-citizen students. And these policies have been shown to really matter. But what's happening, though, is that because ICE activity is ramping up nationwide, states need to monitor how those federal changes are impacting individuals or non-citizens specifically ability to utilize these resources that they're making available to them. I also think there's a role for nonprofits that are already doing really great work on the ground, connecting families to housing, food, helping people safely access jobs, and even accompanying them to their immigration appointments. And I think finally, communities need to create spaces where non-citizens feel supported, especially in churches and schools and in local organizations. So I'll stop there and can come back to this in a little bit.
Wonderful. That was excellent. I think gave us some broad context, but also some very specifics. I know I'm looking at the chat. People want to know, what can they do, right? What action items can they take? So I greatly appreciate some of that action in there. Danielle, how about we turn to you next? Again, we'll start with, tell us a little bit about your broader work and how it brings you to this particular project before I ask you your first question, please.
Thank you, Dr. Sanchez, and thanks everybody for being here with us this morning. I've been working for a little over 2 decades now around the issues of broadly social determinants of Latino and particularly Latino immigrant health and healthcare issues, looking at healthcare discrimination, medical mistrust, but also more community institutional policy, both barriers and levers to improving access to healthcare services, ultimately maintaining and improving the health and well-being of Latino immigrant communities in the U.S. And also over the years, I've maintained connections and trying to look at these issues also transnationally. And I think that's one of the things. Some of the data, some of our questions here speak to that effect around. So, for example, remittances, and so the ways in which communities here in the U.S., both in our case, both naturalized citizens and non-citizens, continue to maintain those connections. I think that's also another part of the equation too, when thinking about sort of levers for Latino immigrants to be able to weather to respond to the effects that we see with this survey, but in the current moment as well.
Excellent. Well, welcome to our panel. Dr. Lopez Caballos, I'm going to ask you your first question that hopefully speaks directly to your background research, and I know what you spent your life's work conducting in terms of your academic research. You know, we saw the data. It paints a not so pretty picture regarding the current anti-immigrant climate, anti-even Latino or Hispanic climate, high rates of discrimination, right, directed towards specifically Latino immigrants. So I'd love to hear your thoughts on what are some of the broader implications of this climate. And, you know, this is in line with what I'm seeing for the chat. A lot of folks asking implications, not just for Latino immigrants, but are there implications for the broader Latino community?
Yeah, great question. So we've seen, and Dr. Sanchez mentioned earlier about the survey in 2015, and we had, using that data, we had looked at the implications in terms of the quality of care and the perceptions around quality of care of these larger anti-immigrant, anti-Latino environments. So we do see that in sort of these, as was mentioned in the presentation, it has increased already, even though, you know, at the time of the survey, right, we have seen since then an even more visible, more ramping up of immigration enforcement that has, I think one of the key important things here that is, yes, well, you know, the rhetoric has changed from focusing specifically on going after violent criminals to be a broad scope of immigrants. I mean, just in the news, folks probably have heard about a landscape worker with 3 U.S. citizen children that was brutally picked up while doing his job in California. That it is a very broad scope, and so that um, even in the context of the narratives of their actions, we see a spillover effect. So the important thing here is that it is not just a particular community, say the Latino non-citizen community, that is seeing these changes and reacting to that, right, and trying to navigate this environment. It has broader implications, as we see in our study, for both non-citizen and naturalized citizens, and I would argue, and we have research to point out to that effect, that spillover effect has implications for the broader community too, because the behaviors of Latino, say specifically, even narrowly, say that the behavior of Latino undocumented Latinos definitely is has had to drastically adapt to the current moment, but broader too, because as our data shows here, that the experiences of discrimination are happening both to non-citizens and naturalized citizens, Latinos, and but they are also embedded in larger communities. I think that is important for our participants to notice, because it has consequences for how, again, not just undocumented, not just non-citizen or citizen Latinos, but also for the communities that they are embedded in. You know, a share of our population has a mixed status, and so when they are trying to draw a line and to drop the hammer on a particular line that they have, I would argue, arbitrarily drawn, then it has a spillover effects across the communities. And when it comes to the consequences in terms of, say, accessing healthcare services, we see it in this data that chilling effect and avoiding care until it's absolutely needed.
Excellent. Thank you, Danielle. You can see we brought together the right minds for this conversation. I greatly appreciate the conversation we've had to this point already. Finally, Anna, if you would tell us a little bit about yourself, your research, and how it brought you to this particular table, and then I will ask you your first question.
Thank you so much for the opportunity to be here today. Yes, I've just finished up my postdoc at the University of Texas at Austin, and I'm heading over to the University of Wisconsin-Madison to start as an assistant professor in political science there. My research really focuses on how national level immigration discourse and policy filters down to shape local political behavior for politicians like mayors and city council members, and also city residents, especially among Latino communities. So I study the impact of nationalization, this political phenomena that describes the way that national level politics is leading into and sort of filtering into local level contests. And in some ways, I argue that this ideological, like nationalized perspective is actually shaping the ways that local actors are responding to the issue of immigration. And during these sort of the first Trump administration, and also now extending this work to the current administration as well. And I came to this project really because there's very limited data on this population in particular, especially non-citizens are very sort of wary of taking these types of surveys, and especially in these political climates. And I really wanted and was very interested in understanding the way that they looked at their local responses to the Trump administration. And so we have some really rich data on that as well. And I'm really excited to be here today. Thank you.
Excellent. Thank you much. Before I get to your first question, you reminded me something I should have noted in the methodology statement. A lot of folks, professional pollster, survey researcher, a lot of folks have asked me, can you still survey immigrants in this climate? And one thing I will note is it took us longer in the field than we've expected, but we were able to get to our target of 1,000 and ensure that it was quality data. So if folks tell you it can't be done, call our team. We were able to make it happen, again, a little bit longer in time than we usually would take, for good reason in this climate, as Dr. Oaxaca Carrasco noted, but we were able to execute that. So Anna, I've had the pleasure of knowing and working with you since your undergraduate years, which has been a great pleasure for a professor like myself to be able to see some of you develop so strongly in a relatively quick period of time. So I know this question is lined up specifically for your background, your knowledge, your expertise. As noted, right, the survey suggests that Latino immigrants oppose, in many cases, overwhelmingly oppose the immigration policy agenda of the Trump administration, including a large part of our conversation around mass deportations. Based on your own research on Latino political behavior, the survey data that we've collected here, this is directly in line with one of the questions that just popped up in the chat as well. What are your expectations regarding the voting behavior of Latino immigrants, whether you want to frame that in 26, 28, beyond? How does this data give us some thoughts about the political aspects of this population?
It's absolutely a riveting question that you ask. I think everyone's really looking forward to what's going to happen next. And I think what we see really in the data aligns very strongly with existing work on the political consequences of these kind of targeted policy threats. Latino immigrants, even when not eligible to vote, are highly attuned. So they're paying attention, right, to immigration enforcement as both a policy and a symbolic message about belonging and what I call the small c citizenship, right? They understand where their place is when they in American society based on the way that they are treated and are targeted with policy. So what stands out to me in the survey is this overwhelming disapproval of the Trump era immigration agenda. We are seeing that immigrants are opposing the Trump administration in similar ways that they did in other in other contexts as well. So particularly the association of mass deportation policies with fear, discrimination, and alienation, they are really responding to that, right? So over half of the respondents, they worry deeply about their family separation and deportation. Significant portion, right, 36%, fear being detained and deported themselves. It creates a powerful backdrop for political mobilization. So we understand that from past literature and some of the work that we've been doing at UNM, at UCLA, and now at UT Austin. And while we know that many in this population are sort of not eligible to vote themselves, right, because they do not possess citizenship, we know from prior research that they do influence the households that they pertain to, and the communities that they extend to, and far beyond that as well. So I think in mixed status families, eligible members really sort of are able to shape these political moments in their families and within their community, and sort of act as a way of protecting and representing their community. So I think looking ahead to 2026, I actually do see and expect to see a continuation of two key trends. I think issue-based mobilization is one, right? Latino voters, particularly naturalized citizens and US-born sort of children of immigrants, are sort of likely to view immigration policy as sort of a litmus test, right? A heuristic for candidate support. And we've seen this in past cycles, that anti-immigrant rhetoric can really backfire and boost turnout and political engagement among Latino communities. So I wouldn't be surprised to see the like in 2026, as quickly as 2026. During the elections. And so I also feel very strongly that local level resistance in civic activation and participation at the local and state levels is going to really thrive under this kind of political backdrop. In cities and states where there's more exclusionary enforcement and policies being sort of preferenced, I believe in the data show that there will be higher levels of grassroots political activity there that we can see sort of shaping the way that the people are responding to these elections. So I think in short, policies of threat are producing very negative externalities for Latino immigrants and their communities, but also they're feeling political resistance in many ways, right? So the Latino immigrant communities are watching and in many cases activating their networks to respond.
Excellent, wonderful. I appreciate everybody being on point, great wisdom and insights, but being as succinct as possible, which allows me to get to more of the audience questions. So thank you all very much for your approach with answering questions that I know all of you could speak to in much greater detail and length. I'm looking at the chat. Thank you, wonderful audience. For those of you who might have tuned in a little bit late, remember, if you have questions, events@brookings.edu is where to send those. I'm vetting those as we speak to pull as many out for our panel as humanly possible. Folks that sent in questions in advance as you RSVP'd for this event, I'm going to pull the first one from that subset of questions that we got for our next conversation with our panel. And you know, this one, many of you noted on this in different ways of asking the same question. Basically, folks want to hear some positive sunshine in the context of very dark times, right? We know that the data suggests that unfortunately, right, this is a very challenging and dark time for immigrants, for Latinos, for a lot of other subgroups across the country that are feeling the pressure of the shift in deportation policy. So I'm hoping that with our next question, each of you can speak to the optimists like myself in the audience who want to see something positive from the data, in essence, to keep us going, to keep us energized, to do the work that many of us do to try to address these challenges and support this particular community. So can each of you think a little bit about something positive from the survey data that you can share with us today? I know a lot of the data points that Dr. Vargas and I broke down weren't exactly the best way to start a Wednesday morning with. I'm hoping there's some nuggets in the data that each of you might be able to pull from to give us a little bit of insights and give us some little bit of uplifting feeling or attitudes about the climate that we're in. Why don't we go in reverse order this time? Dr. Oaxaca Carrasco, how about we stay with you? If you have something positive, give us some positivity if you have it.
Well, yeah, thank you so much, Dr. Sanchez. And I think this sort of leads into the question that we were talking about earlier. I think that the positive is mobilization. As much as we like to talk about democracy, it's a process of being involved in politics and also sort of being part of the citizenry. And I think our immigrant communities are definitely moving towards that mobilization in this moment in time. From the survey, we really are seeing some early evidence of mobilization. We can't really say that people are, gearing up to vote, and because that's not happening right now, but we are seeing some early evidence that other scholars, political scientists such as yourself, Dr. Sanchez, have produced prior work on back in 2001. And we see that this is quite a while ago, but we're still talking about
I was
this.
10 years old back then. I was going to
How could you have written that? You were 10. So yeah, no, we're seeing a lot of the similar patterns there, especially among two data points that I really want to point to. One, the registration to vote is up for 8%, and they have started the process to acquire permanent residency or citizenship since the Trump administration, and that's actually at 8%, and the registration is at 9%. So we are seeing that there's some gear towards mobilization, and this is exciting for democracy.
Oh, those are excellent data points. I'm glad you brought that to the table, right? Because it gives us some, for those of you that are hopeful in the audience, indication that what we saw in California around the Prop 187 effect, similar dynamics in Arizona, that mobilization towards punitive policy has generated, right, mobilization efforts, both in naturalization and registration. Excellent. Thank you for that.
If I can add one point that I hadn't brought up
Please
yet.
do.
The mayoral race in New York City actually is pointing us towards a sort of understanding of where the Democratic Party may live within progressive politics, right? So we saw the primary between Cuomo and Mamdani, and Mamdani rose sort of victorious in that. He was very adamant about policies that would support immigrant communities, expand their assistance and aid, especially with the kick the ice out of all the city facilities call that he had. So I think in ways that we see positive mobilization occurring, those are some early signs, but also if you look at local politics and sort of early decisions like this, they may sort of point towards the Democratic Party where they're heading.
Excellent. Thank you for that, right? So much is changing in the political world almost hourly, right? I appreciate connecting some of the dots to what we're seeing with what's going on across a very recent election. Danielle, what about you? Is there any nuggets from the data that you think might give us a little bit more positive or uplifting? All of us feeling that we need that to keep us going.
Yeah, thank you, Gabe. I think a couple of things as well, and to build on Dr. Oaxaca Carrasco's points, I think two things that I see in the data where I can see we can build from. One is the approval for labor unions. We asked that question, and participants have 41%. They said they approve of unions, higher among naturalized citizens than non-citizens. Naturalized citizens 49%. They said they're so close to half that I think it speaks to sort of this more of a collective, and what possibilities there are for more collective action that I think so challenges sort of in the larger national broader US population where these ratings are definitely not there. So that I think is one. And then the other thing I think is space in a federal environment in this federal concept, very constrained, very deleterious for Latino immigrant communities. I think much of the action, and we see with the many lawsuits that have been filed against federal actions, that at the state level, and one of the questions that we asked about the laws, immigration laws at the state level, and 38% of our participants spoke to the state thinking of the immigration laws favorable towards immigrants, and so that about 38% spoke both, and similar for both naturalized and non-citizen participants in our sample. To me, that speaks to what is that part of the action, right? The mobilization that Dr. Oaxaca Carrasco was speaking about happening at the state level. I think that's where I think we see some of those benefits. And then perhaps extending that a little bit, maybe connecting these two things, is that the sort of the footprint of in terms of the actions that have been happening with the several lawsuits that attorney generals sort of there's a coalition, a growing coalition of state attorney generals that are working in tandem to challenge that in courts with some success, right? So there are several things that have been paused because of these actions that I think that helps, I think, helping us think through what, again, in this federal context, what we can be doing both within specific states, but also in coalition, sort of a larger coalition of states that can sort of provide a counterforce to this. And then maybe we'll come back to this later, but I think sort of in this growing coalition, thinking also that for the fact that a majority of states, including DC, have expanded Medicaid, 41 to this day. So including only 10 Republican-led states have not. But a majority of the states, including Republican states, have expanded Medicaid. So I think that in terms of that coalition, particularly with the so-called Big Beautiful Bill, that I think is a coalition, sort of as a goal for a coalition that we can build up to.
Excellent. Thank you very much. See, we're getting some positivity. Hopefully this is giving everybody the energy that they need to carry on. Carmen, last but certainly not least, anything positive, any nuggets from the data that you think might speak to a little bit rosier picture than what we've discussed so far?
Yeah, well, earlier I had commented on the chilling effect. And so, for example, our data showed that 10% of immigrants are avoiding going to work, but 68% of immigrants said that they are still going to work. And I think what, we need to, and they're not avoiding, 72% is not avoiding public spaces. And so I think we need to take a step back and recognize that Latino immigrants come from a long and painful history that's rooted in colonization. And so they've experienced dispossession, displacement, oppression, both in their native country, during migration, and even in the US. So I'm not trying to, downplay those challenges, but I think our data shows that immigrants are not giving up. And there is a chilling effect. People are afraid. They don't want to make a decision or behave in a way that will call attention to them negatively. But that only goes so far. If you need to feed your children, if you need to take care of your children, if your children are ill, you are going to take them to the doctor, or you are going to go to work. So I think instead of asking what people should be doing in the face of adversity, the better question is, how are they adapting? How are they resisting? And how are they working through this system that can feel like it's working against them?
Absolutely. And I think you hit on a point that a lot of us are seeing a lot of bravery, right? A lot of immigrants putting themselves in harm's way, to step in some cases and say, do you have any grounds to be able to detain individuals that they're seeing in their own neighborhood? So I think the fact that you note that despite all of this context, immigrants are still thriving, they're still surviving, and in many cases, they're pushing back aggressively on this environment, I think directly speaks to that rain of sunshine, if you will, from some of the data that we're seeing that gives us a little bit better context. Greatly appreciate you, panel. I think we're right on schedule to shift to a little bit broader questions from the audience. Thank you in the audience. Many of these questions are outstanding. So I'm going to do my best with the time that we have left, about 25 minutes or so, panel, so that think about that in the context. In some cases, take as long as you want to answer these questions. In other cases, let's be as efficient to allow me to get through as many questions as possible. Note that in many cases, these questions that are coming from the audience, I believe, are aimed at everybody. So I'll try to just pitch those. Don't feel as though you have to jump on any question if it's not in your area of expertise. And in some instances, there's a couple questions that are directed towards specific folks based on your commentary. Dr. Vargas, I will invite you to join the panel if any of these questions that come from the audience speak to your area of interest. There's a couple that I think are in the data methodology section that I myself might tackle, or Dr. Vargas, I'll turn to you if those things jump up. So let me see here. The very first question, I'll start with this one primarily because many people have noted this in a number of different ways. A lot of interest in what are the implications specifically for children in schools, whether that's drops in school enrollment due to deportations happening on or near school grounds, access to Title I funding supports, and others. Just think about this as what are the implications specifically for our youngsters? And context for the audience, I know many of you know this data as well as I do. Keep in mind, Latino immigrants are significantly younger than the general population. In some instances, in some states, up to almost 20 years in median age difference between Latino immigrants and other communities. So because of that, Latino immigrants tend to be disproportionately concentrated in public schools. So this question about what implications does this have for our youngsters, right, has huge prominence just given the underlying demographics of the population that we're talking about. So I'll throw that out to all of you. I know a couple of you are probably more equipped to be able to jump on this, but anybody who wants to speak to this, I will note, Hannah and Annabelle, thank you for this item. You were among a handful of folks that all were interested in learning a little bit more about implications specifically for children.
I'm happy to take that. Dr. Vargas, did you want to speak?
Let me just say something really quickly, Dr. Valdez. And I want to first go back a little bit about, I think, the good stories. I want to start there and have a view about children in school. One of the other things that we've kind of sort of good stories that I want to relate to the audience is this idea of the American dream. A large majority of the Latino immigrants in the sample still believe that the American dream is still possible. And they very, very much believe that success in life is determined by hard work. That came clear in terms of, I just want to say that, and this idea that at this time when they're asked about their feelings, that they're feeling empathetic, and they're feeling empathetic for other people like them around them in their community that are going through this. Now, going to kind of school and the school level policy, well, what we know about deportations, and particularly mass deportations across the country, is that it disrupts schools. It disrupts neighborhoods. It particularly, in terms of policy, it particularly disrupts attendance and truancy in these schools. And so some colleagues and I have published and been looking at sort of the aftermath of a deportation raid in communities. And we find, right after a raid and before the raid, leading up to the raid, we just start seeing disruptions in school, and we see kids, parents not sending their kids to school. So I just wanted to point that out. And then I'll pass it over to you, to Dr. Valdez, but I just wanted to say that real quick.
Yeah, no, that was perfect. Yeah, so kids are definitely feeling the effects, and they're feeling them directly but also indirectly, right? So at the very least, if their parents are deeply worried about their loved ones, then kids are exposed to their parents' stress. And kids also have this fear of deportation. Many kids that I speak with talk about they're afraid of not only losing a parent, but things that we might consider to be superficial, like they don't want to lose their home, they don't want to lose their phones, their friends, so they really worry about these things. And that constant worry can take a toll. And a lot of research is showing high levels of PTSD, of post-traumatic stress disorder, in kids, just based on what they're witnessing secondarily on the news, but also what they're hearing from their own community. Plus, they're also experiencing more insecurity related to food, housing, or related to their parents' employment. In fact, there was a study, I can't remember the exact date, but it was from around 2005 that looked at a raid in Indiana that happened at a factory. And they found that children from the parents who were deported experienced food insecurity for up to 12 months. So, that's we can anticipate that this is something that's going to be happening. And then Dr. Vargas mentioned schools, and recently a report by the Casey Family Foundation, KFF, showed that in Boston, like the Boston area, there was a drop in school attendance of 1,000 students in the wake of ICE activity. And then in other places like in Chicago, just in the days immediately following the inauguration of President Trump, there was a 50% drop in school attendance. So I think this is a wake-up call, and I know school administrators and counselors are working hard to come up with protocols for, if ICE wants to enter the school, are working with parents to create safety plans. So I think it's great that these schools are understanding the context of families and wanting to be as supportive as possible.
Excellent. Thank you, Dr. Valdez. Danielle or Anna, either of you want to tackle this one on implications specifically for schools, young children?
Let me just add one thought is that because I think particularly of this current moment in that there has been a shift in how immigration enforcement no longer respects sensitive locations like schools, right, and others, churches, etc. And so that I think just heightens this environment of fear. And we have seen reports of actually happening, not necessarily of going inside the schools, but certainly immigration enforcement waiting for as parents are dropping off their children in schools, they're right there, and it's sort of as a common pattern when folks are going for their immigration appointments in federal buildings, in other instances where so that I think has consequences. So I think one of the points in the data we talked about, knowing that if folks knew about sanctuary cities, and just about a quarter of the sample set I talked about, and 42% said they didn't know. So I think a part of I think part of our working in collaboration with community-based organizations and local officials is to have that. Says, there's many communities that have that. What does that mean? If families don't know that is something that their city is standing up for, their city, their town is standing up for, and sort of I'm thinking about is like what yes, there is that immigration enforcement, but what are sort of these buffer zones that in cities, in locations where these statements, sanctuaries, to make it tangible, I think for our communities, what that means in practice. And I've seen examples of allyship, to where the visibility in a particular pushing back against this immigration enforcement you cannot have Latino immigrants being sort of at the very front line of that, but allyship is important. So what are community members, community organizations that can take that on and be very upfront in pushing back against what's happening in schools? But I know that that there is trust in schools, and in our work in Oregon, done with through sort of a navigation community health worker model. So there is that trust there. It's just the moment you start, that getting your kids to and from schools, it happens with driver's licenses too, and lack thereof. But how we sort of rebuild on that to preserve that, we know is there, and just again sort of pushing back and creating sort of a broad sort of an ever growing, if I had my wish, of these buffer zones to push back against the sort of the creeping in of immigration enforcement into the school zones.
Excellent. Thank you very much. Anna.
Yeah, I had a quick thought. I think coalition building, especially at the local level, will be very, very important when it comes to children and protecting children. A lot of people already feel this way, right? We're not seeing, I don't think, a lot of support for some of the things that are occurring at the school level. So how do we sort of empower communities to not only believe that they're alone, right, but that they can search for protection across communities, across different like-minded people. And so I think at this point, we always try to empower Latino communities, immigrant communities, but at this point, we must also empower those that have like-mindedness when it comes to children and protecting them, so that they can also be at the forefront of this fight.
Excellent. Thank you very much, wonderful panel. I'll note a couple of the questions that came in from panelists that I can clear up immediately and leave a little bit more time for more substantive questions. Note that the survey questions and exactly the top lines as well, the results across the full sample, are available. Folks have, several of you pinged to ask that question. During the event where you're RSVP, that landing page should, at the end of this webinar, have link to a blog post that this team produced. There's an active link to the top lines of the survey results that you can find there. So you can grab those. The slide deck from today's panel will be made available there. So those of you that are hungry to see the data in more detail, look there after the webinar wraps up and email me, Gabe at brookings.edu directly if you have any questions or anything that I can follow up with. And then one other one that already came up that I just want to speak to, and Danielle's comments regarding sanctuary cities. Dr. Morin out of CSUN, I see your question. I'll note that you'll see in the top lines, we asked some questions about perceptions, as Danielle noted, about whether they perceive they live in a sanctuary city or jurisdiction. And we have the availability to geocode respondents to be able to match that with where there's active lists of sanctuary cities. I know you and your team, Jason, have been doing some of that work. Folks, I suspect haven't done that level of research on our team. The data's pretty fresh, but stay in touch with some of the folks, Dr. Morin, and I'm sure you can find out more information about that. All right, so I'm going to turn to the next question from the audience. I'll thank Ryan from the American Medical Association for this one. It's a good question. So again, pose this to the full panel. Feel free to leave this one be if you want to sit it out, but everybody take a bite at this apple. This question from Ryan asks, what does the future of immigration policy reform look like in the longer term? And he follows up to ask, what do you see as common sense reforms that both Democrats and Republicans might get behind and support after the Trump regime ends that we can begin mobilizing around now so that hopefully things are lined up for, again, his point is some commonsensical bipartisan immigration policy down the line. Any thoughts on that one? It's a great question, Ryan. I appreciate it.
I'd like to chime in on Jackie or Senate looked of only strategy to immigration policy at the federal level. And there really is a lot to say about how these types of policies are impacting the economics of different states, especially Texas, right? We do have a lot of immigrants sort of intertwined with the state and the ways that the state produces its economic capacity and everything else in between. And so I think that the future of immigration reform really hinges on whether we can move past crisis-driven politics and towards durable, pragmatic policy making, right? And I think at this point, post-Trump, I think people will be particularly open to try to look for pragmatism in sort of moving away from this weaponized way of looking at immigration policy. I think first shifting the frame from enforcement only to a comprehensive modernizing strategy would be really helpful. We're still operating under the laws that largely written back in 1986. That's a 40-year gap and difference between our demographic reality and this mismatched policy that has been coming out of the federal level. And so any serious reform really does need to update these legal pathways to employment-based immigration based on the fact that a lot of the economic realities in states like Texas and others depend on immigrant work. And so that is one of the most sensible paths to producing a reform that is a bipartisan solution.
Excellent. Anybody else? Common sense, bipartisan oriented policies we might be able to get behind and mobilize on now.
I'll jump in and say something that I think is looming, and it's really at the intersection, really, of domestic and immigration policy. Is what do we do with the U.S. citizens who we've deported? Finding policies to figure out. We have these children that were being deported during a different administration as well, who are growing up and living in Mexico, who are U.S. citizens, but can't, for example, access their birth certificates or passports because in the deportation sort of of them being snatched away, they left all the documents and them not being able to get those documents. So we need to figure out, and it's very complicated because it's both domestic, because these are U.S. citizens, and they're growing up in, for example, Mexico. And so trying to figure out a solution to how do we integrate them back into the United States? Again, these are U.S. citizens who have been deported, who their parents have been deported, and who are having children, who are having family in other parts of Latin America. So I think that's something that is, I think, can be a clear avenue for people on the left and the right.
Wonderful. Anyone else that hasn't had a chance on this one? Any commonsensical policies we might expect to be able to mobilize around down the future?
Let me just say one thing. I think in the current moment, and we see this. So, for example, what is being discussed in California about going back or reducing the protections for undocumented immigrants, specifically around access to care. That I think in the it may have economic foundations, but I think this is sort of what we see at the federal level. But I think not to fall into the temptation of taking this moment to say, okay, the reason or the reason may be economic, but the realities are that I think it's important to clearly push back against that at the state level. So for states that have worked hard to expand policies to provide access to social services, including healthcare, health insurance, regardless of documentation status, for those sort of at the state level to continue working, right? We thought it was something that is already done. It wouldn't be take back, but it needs to be, and for working with our elected officials, our representatives, in coalition, as Dr. Oaxaca Carrasco mentioned, to monitor that, right? And to remind our elected officials at the state level that this is not the moment we can say, oh, well, this is happening at the federal level, we don't have to do this anymore. That is not that shouldn't be the case. And in fact, I think the response again is to lead with sort of strengthening, solidifying those protections, because we see the benefits not just for those communities, for those individuals, for those families, but for the larger communities in which our Latino immigrants live.
Excellent. Excellent. One other quick question. I'll just note a few folks have asked more questions specifically about youngsters, about children. A couple of you, your questions, I know we don't have the data to speak to in this survey, but I will plug tomorrow already. Abriendo Puertas and Unidos US will release their National Latino Family Study. So take a look, Google Unidos US, Abriendo Puertas to get information about that webinar. I'll actually provide the slide deck presentation, and there'll be a lot more content specifically to how these things have implications specifically for youngsters and families. So keep an eye on that. Next question, just time check. I got a little less than 10 minutes, so I'm going to smash these through quickly. Let's be a little more efficient in our responses, because I might be able to get in 3 more questions if we play our cards just right. This question comes from Dr. Maria Ramos Olosgasti. So thank you, Maria, for your question. She asks, how are the data and results being used or will be used to advance policy and systems level change? And I'll say, as an entree to this question, for anybody who wants to tackle it, I would commend these scholars, right? Many of them are in places where talking about this isn't exactly the most popular in terms of the politics of their venue. And most academics wait quite a while before they allow releases of academic style survey data because they want their peer-reviewed publications, etc. I will credit this team for wanting to get the data out quickly because they know, right, the implications for policy and all that happen faster if the data is available. So credit to all of you. But any thoughts on how you might use the data to advance specifically policy and systems level change?
I can say a few words about that. I think the way that we're going to impact policy is through the force of the people. And by the force of the people, I'm talking about all of us in this country and all of us whose lives are touched by what we're witnessing is happening. So I think this data, I'm glad we're reporting it out so quickly to this audience. I would encourage our team to also take this data to healthcare providers, to schools, to churches, to coalitions, as Dr. Oaxaca Carrasco mentioned, so that people can be informed of how, of what the, not only the humanity of what we're seeing, but also the implications on U.S. economy, on labor force, et cetera, et cetera. And so I think the more we can get this data out to different sectors, the stronger we can be in not only responding to the crisis that's being experienced, but also proactively planning for the future.
Excellent.
I'll go next and say, some of the thoughts I had were around sort of data advances in terms of mobilization and system level change. What wasn't presented today was that a large majority of immigrants are avoiding protest. And again, makes sense. You don't want to be at a protest if they know that it's going to turn potentially, there's going to be police involved. So I think that is a responsibility for our U.S. citizen folks to step in. And we're seeing that already. I think when we started this data project, we didn't think, and this kind of goes to some of the folks who voted, for example, Donald Trump, because they thought he can get the economy back in line. They didn't know that they're also going to come after my loved one. And I think we're already seeing people that are being caught within this web that, look, this person isn't a criminal. This person is my local elotero who's being snatched up. He works every day and gets up. So I think part of this, I hope, will mobilize people to be, to think about like, well, they lied to me. They said they were going to go after criminals. My elotero isn't a criminal. So I think this just speaks to, I think the hopefully people will mobilize and they'll know that we need people to help and step up and protect our community.
Excellent. I'm going to move us to Danielle. Did you want to jump in?
Just briefly, Gabe, if I may, I think one of the things that it speaks and connects to the discussion of HR1 being in the Senate right now, in the U.S. Senate, is around the concerns around costs of care. And in our study, 39% they mentioned they will get worse, and I think that goes in line to reporting from the budgetary impacts that the Congressional Budget Office has released, and how regressive, if it were to pass, how regressive this bill is, and the impacts for the broad impacts from middle to lower income families across the country, including Latino families. And so that's another point important to drive further for coalition action, pushing back against that.
Excellent.
I had a quick thought about the way that we see data, right? One of the really exciting things about having this kind of data is that we can sort of manage and be able to tell the stories with some empirical evidence that mostly everyone believes, right? But I do want to problematize, right, the idea that data changes a lot of minds. So I think part of it is we can use our data to show the realities, but there's also a very limiting factor here when it comes to immigration policy and the way that people look at immigrants. It's a moral issue as well as a philosophical issue, right? So it goes beyond sort of the data question. For us, it's very important for our jobs and our capacity to explain and be the informed voice of reason, but there's also some limitations that come with sort of relying purely on data. So I think that combining this rich empirical evidence with the voices of communities, the voices that we are sort of ignoring for the most part, will be very powerful, right? So I think having not only that pragmatism of data and the ability to show real numbers, but also having the stories that go behind it will really push this kind of narrative forward.
Excellent. I'm going to ask one more question before I give each of you a moment to close us out with your words of wisdom you might not have had a chance to touch to. If we could be very brief on this one. It's a really good question, however, and it's essentially, have similar trends and fears surrounding deportation been observed in Latino communities under prior presidential administrations? and what, if anything, is unique about this current climate. I'll start with an entree noting at the beginning, Dr. Vargas and I did a study just like this one back in 2015 under Democratic leadership and found similar results in many areas. So it's an important question to note. This isn't specific to the Trump administration. Unfortunately, things haven't exactly been awesome for immigrants under Democratic control either. Anybody want to take a stab at this one? Prior administrations, what might be unique about this climate? I'll jump in on this one. I'll start us off, Danielle. I saw you unmute. I think a couple of things. Obviously, during the Obama administration, I know my team spent a lot of time pointing out implications for deportation. Folks might remember deportation numbers were very high under the Obama administration. So we've lived through environments, unfortunately, for quite some time, both Democratic and Republican-led, where immigrants and deportation was something that us experts had to track very closely. A couple things I'll note that are different. I've never heard any conversation about removing birthright citizenship. I've never seen a US Latino senator being arrested physically for the context of asking questions about deportation policy. So I think in many cases, and this question got this right, that the rhetoric, the symbolism, the enforcement moving into areas typically off limits to ICE. Danielle noted already schools. A lot of the climate has shifted more punitively and aggressively, even though some of the underlying mechanics to lead deportations, obviously the Trump administration did not create or invent themselves. Danielle, anything else that I saw you unmute that you wanted to add?
Yeah, I think a couple of things that I noticed to build on what you said, mentioned, Gabe, is the sort of ICE and broader and all the different agencies within the Department of Homeland Security. They're bringing in other and connecting other sources of data, IRS, and within that also security forces that are brought on to conduct immigration enforcement actions. Sort of the level of visibility, but also the unmarked cars, the unidentified police, ICE officers that show up and without identifying themselves, without a warrant, etc. That I think it's sort of the level of coordination I think makes this sort of uniquely of this moment.
Thanks.
I would just add here and say, one, I think something that's unique in terms of what we're seeing now is really the lack of due process, the doing away of due process, which is really at the cornerstone of our democracy. That's one thing. Another aspect to see this is this kind of twofold or threefold angle of, in some ways, this new administration they're going after. In the academic side, right, they're going after Harvard and Columbia, which are some of the top elite institutions of the world, right? Here they're going after California really hard. So I feel like there is this angle you try to get at the top, and then people will kind of fall in line. I'm glad I see that. I think California just passed a vigilante kind of law where people should have to like show who they are instead of just being unmasked. We don't know who these people are who are coming into our community. So I think that is, a unique aspect of this administration. I think Carmen was going to say something next.
Yeah, I just wanted to point out the dehumanization of immigrants that has been part of the current administration, and that we saw both in the first presidential administration back in 2017 and then now. And I think that's a very dangerous practice to dehumanize immigrants, because when we talk about them as criminals, then we can justify not only forcibly removing them from this country, but putting them in jails in countries that are not even their own, right? So I think that's a very dangerous practice that has not been present in other administrations.
Excellent. With that, last couple of minutes, if anybody would like to, I welcome the full panel, share any last minute words of wisdom, any closing remarks before we wrap up our wonderful webinar today.
I wanted to speak to a little bit about the last question as well, and talk about the differences really is political strategy, right? We've noticed in the Trump administration that this is a political strategy, and one that they're really leaning into from the first administration and during the elections that have been fought very well fought, and we're going to continue seeing that in the next 3 years. It is about political strategy. Immigration is an issue that the Trump administration is winning on right now with their base. And that is part of the reason why we're still seeing a lot of push. And I think as long as that is going on, we won't see sort of a shift. And that's the reality. The reality for the communities, immigrant communities, is that they're living through a time where they're being used as pundits and being used as part of this larger political strategy from a very powerful source. And that is the heartbreaking news that it's not going to end for a while. And even though that's not sort of the positive takeaway that I wanted to leave on, I think the reality for all of us is that this is a fight for the long term, and we're going to have to use every moment to continue on fighting for human dignity for our immigrant communities.
Excellent. Anyone else? Last closing remarks. Going once, going twice. Excellent. Perfectly timed. In closing, I'd like to thank our wonderful audience for your great questions, for being with us today. Again, look at the landing page to get the slide deck, top line results, and a blog post from our wonderful panel. Thank you, panelists. Some of you got up, I know, well before 8 a.m. your time to participate in today's webinar. You were excellent. And thank you, my colleagues at Brookings, for always being a platform that welcomes rich, rigorous, data-driven discussions around public policy, including immigration policy. Thanks, all of you. I hope you have a wonderful rest of your work weeks.
Thank you.
Thank you.
Thank you so much.